Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, Steve Daly. It's Tuesday, September 23rd. Today on HITshow, Banner Health doubles down on ambulatory care with new Health Center Plus hubs. California loses another critical access hospital as Glenn Medical Center prepares for a full closure. After the break, we'll look at new innovation partnerships in digital health, a combined cybersecurity update hitting hospitals and blood centers, and two pharma stories focused on obesity treatments. One is a $7 billion acquisition by Pfizer, and the other is about a novel approach taking a biomimetic route. Let's get started. We begin with a major system betting big on outpatient growth. Teresa Vaughn has the story.
Banner Health is moving ahead with its Health Center Plus concept, multi-service outpatient hubs designed to capture patients in value-based primary care while growing referral networks. The first Scottsdale location will open next year, combining urgent care, imaging, pharmacy, and wellness in one destination. Executives say these hubs represent a cornerstone of Banner's long-term strategy to shift more care out of the hospital and into ambulatory settings. With multiple projects underway across Arizona, Colorado, and Nevada, Banner is signaling confidence that patients want convenience bundled with system connectivity.
Teresa, does this put pressure on competing health systems?
It does, Steve. Smaller systems without the capital to build comparable hubs could struggle to compete for commercially insured patients in these markets.
Important dynamics there. Thanks, Teresa. Our second story takes us to California. Logan Stokes reports on the accelerated shutdown of a small rural hospital.
Glenn Medical Center in Willows, California, will close its emergency department on September 30th and shutter the full hospital 3 weeks later on October 21st. The 25-bed facility recently lost its critical access designation, which sealed its financial fate. Community leaders warn that without local emergency services, residents will face travel times of 30 minutes or more to the nearest ER. The closure adds to a string of rural hospitals folding under reimbursement pressure, leaving gaps in care for vulnerable populations.
Logan, is there any plan for replacement services in Glenn County?
Not yet, Steve. Local officials are scrambling to line up urgent care coverage, but the reality is that inpatient and emergency care will disappear for the foreseeable future.
A tough blow for that community. Thanks, Logan. Coming up after the break, innovation partnerships that could reshape chronic care management, a cybersecurity wake-up call hitting both hospitals and blood centers, and Pfizer makes a massive play in the obesity treatment market. Stay with us. HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care their way. And with AI integration, Altera is leading with heart, bringing the human side of healthcare even closer. Welcome back. You're listening to HITshow. Next up, innovation and partnerships. Nate Collier is with us.
Two moves highlight how technology and benefit design are reshaping care delivery. Sidecar Health has teamed with Carrum Health to give members access to nearly 1,200 centers of excellence nationwide. Covering procedures from surgery to cancer care, the companies say 90% of Americans now live within 50 miles of one of these bundled price centers. And in digital health, diabetes platform Glooko is acquiring Monarch Medical Technologies, maker of EndoTool, a widely used inpatient insulin dosing software. The deal pushes Glooko into the hospital market, extending its reach from outpatient remote monitoring into acute care decision support.
Nate, do these moves show convergence between payer design and tech solutions?
Exactly. Both demonstrate that managing chronic conditions and high-cost episodes is now a shared priority between insurers, employers, and digital platforms.
Got it. Thank you, Nate. Cybersecurity is next. Anika Shah has the update.
Two breaches this month underscore vulnerabilities across both hospitals and donor networks. First, Sturgis Hospital in Michigan disclosed two hacking incidents impacting nearly 78,000 patients. Attackers gained access to protected health information including social security numbers, insurance details, and clinical data. Separately, the New York Blood Center reported a breach affecting nearly 194,000 people, with exposed data including financial account numbers. Identity monitoring is now being offered.
Anika, what lessons should hospitals draw from these cases?
Steve, both incidents highlight how even smaller providers and non-acute organizations remain prime targets. It's no longer if but when. And leaders need contingency plans that include patient communication and recovery services.
Sobering but important reminders. Thanks, Anika. We close today with a pharma block focused on obesity treatments. Jade Romero reports.
Pfizer is spending up to $7.3 billion to acquire Metsera, a biotech developing obesity drugs, including a monthly injectable. Analysts say the move establishes Pfizer as a serious contender in a red-hot market now dominated by Novo Nordisk and Eli Lilly. Meanwhile, startup Evolve has launched what it calls the first oral biomimetic GLP-1 supplement. Unlike traditional drugs, the ingestible is designed to mimic the body's natural peptides, promising a non-injection option for weight management.
Jade, are we looking at fragmentation or convergence in this market?
It's both, Steve. The market is fragmenting with new entrants, but the underlying theme is convergence on metabolic health as a major growth driver across pharma, biotech, and consumer health.
Thanks for wrapping us up with that perspective, Jade. That's all the time we have for today. Thank you for joining us on HITshow. If you like these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, Kimchi.com.